Health officials in Minnesota said today they have more evidence that a chemical compound is to blame for vaping-related lung illnesses. The Minnesota Department of Health analyzed black market vaping products and found many of the liquids contain vitamin E acetate. Officials say that compound is used as a thickener. Nationwide, the CDC says nearly 2,300 people have gotten sick from vaping since March, many of them teenagers, and at least 47 people have died.
Okay, so let's talk more about this with Dr. Junad Khan, cardiovascular thoracic surgeon with Sutter Health. Thank you, doctor, so much for being here. This research sort of echoes what we've seen from other work that's being done to try to pinpoint exactly what's causing people to get sick. What is it about this compound that is so dangerous?
I think that's a great question. I mean, I think this evidence is the most compelling evidence we have so far, because they actually put a tube down in the lung, went right to the affected area, and of all the 29 patients, 100% had vitamin E acetate in the specimen. What's causing it? We still don't know. We know it's like a chemical reaction, like a burn that's occurring inside of the lung, but this is the most compelling evidence we have so far.
In this particular study, the focus seemed to be on these black market vaping liquids. Does that mean that someone who goes to a reputable business and buys a vaping product doesn't have to worry?
Well, right now, even reputable places have it. But one of the key findings from here, from the CDC to the manufacturers, is to stop using vitamin E acetate as a filler. So I think, obviously, we don't want people to vape. But if you're going to vape, definitely avoid the black market or the pop-up shops or around the corner. I think those are less regulated, and you'd be a lot more risk from those places.
We were talking about the fact that this compound is pretty common. It's found in a lot of products, but it is something to do with when it's heated, right? That is at least what people are looking at as far as the harmful effect of it.
Yeah, that's exactly right. I think we don't want people to panic, because if you look at your suntan lotion or some food additives, you'll see vitamin E. It's harmless when applied topically to your skin or orally. It's something about when people are adding it to their vaping products when it's lit. That process is causing the problem.
So now that the research seems to be focusing in here on vitamin E acetate as the potential culprit for people getting sick, does that help in terms of treating people coming into the hospitals with these vaping-related illnesses?
Well, I think that's a great question, but unfortunately not really. We know what's causing it, but really the best treatment is prevention.
Right.
We know it's like a burn. We know what it is, but we can't actually go in and reverse the vitamin E burn that's occurring inside the lung. So really the only treatment is to avoid the inhalation.
What about companies, for example, Juul? Let's say that they don't use this product. Do they then have an argument to say, well, our product is safe?
That's a great point. Now, the CDC was very careful to say that they found vitamin E acetate in all the products, in all the specimens, but it's not to say that's the only cause. Other things could be causing it as well.
So obviously people have been using e-cigarettes for 10 years or so, right? Why all of a sudden are people getting sick? Is this a compound has it just recently been added to these vaping liquids?
We think there's been some additive that's been added, and that combination with the vaping mechanism, the sort of the lighting of the vaping, is what's causing the change that's occurring.
But do we think that compound was in the vaping products, years before,
right,
or just recently added?
So many people getting sick.
We don't know. It's possible that this is the vaping epidemic essentially has taken off. There's so many more people doing it that we're seeing it. It's also interesting in the CDC, some of these patients were before we knew what this illness was. So it's possible this was occurring and we weren't identifying it as such.
But your message to people at home, maybe parents with children, and are concerned about their kids vaping.
Well, I think the most important messages from the CDC is kids should definitely not be doing it. We know these companies are targeting kids with the flavors. You have to have a conversation with your children. Even if you think your child is not vaping, one of his friends is vaping. If you use vaping products to stop smoking, the CDC strongly recommends not to go back to smoking, but to use nicotine patches, gums, Chantix, some other means as well.
Okay. All right, a very important conversation. We will leave the discussion there. We appreciate your insight on this topic. Dr. Junad Khan from Sutter Health. Thank you so much.
Thank you, doctor.